Outdoor activities are fun and they can be great exercise, but sometimes the fun can turn into an injury, especially with your teeth. Dr. James Fetsch with Heartland Family Dental Care joins me now. So Dr. Fetsch, do you handle a lot of emergencies?
We do. One thing with emergencies, we try to see them as soon as we can in our office, and so many patients don't realize that their dentist would see them in emergency situations. Sometimes you'll go straight to the emergency room. They're just going to refer you straight back to your dentist as much as possible. So first thing you should do is call your dentist, see if they're there and can take care of you. We try to as much as possible, yes.
What if it's like after hours, though?
Even after hours, oftentimes I'll try to see my patients as much as I can if it's a patient that I've seen before. But after hours, yes, first thing would be to try to go to the emergency room. So.
Now, what are some of these typical dental emergencies?
You know, most often emergencies that we see in kids, young adults, are your sports activities. You guys are talking about the great outdoors and biking and athletic activities and everything. Most emergencies I see with young children are some sort of a sporting event activity where a tooth's been bumped, knocked out, knocked loose, moved, something like that. So.
Now, what would be a good way to prevent maybe a sports-related injury?
As with any injury, the best way to prevent it is to do something to keep it from happening. And one thing that we have, I brought a little sample, is we talk about mouth guards. And you used to get the old mouth guards that you'd get at Walgreens or something, old boil and bake. You take it and you stick it in some boiling water and then you bite into it. Nowadays we have ones that we custom make. And for our kids nowadays that we want something a little bit stronger, we can even make them in fancy colors and everything. What they do is just come into the office. Any dentist can take a little mold of the teeth, and then we make a custom-made form that fits down over the teeth. You see, this one here has a little plastic bumper on the back of it to give some strength to it. So if they do take a force to the front of the teeth, that little plastic piece keeps the teeth from getting knocked backwards. So some sort of a custom-made mouth form, what we call a ProForm mouth guard, is the best prevention.
How long would it take to make one of those, before you could get it back?
We usually get these turned around in one day.
Oh,
we
so
do them in the office.
Quick.
Yeah, I make them for all the sporting teams in Effingham. I made them for the football team, the basketball and wrestlers. So we just try to make sure that those kids are healthy and safe.
Hooking them up.
Yes. Yeah.
Now, what you mentioned, maybe getting a tooth dislodged or something. What happens if a tooth does, maybe not fall out completely, but moves a little?
If they're wearing a mouth guard, chances of something getting knocked out are slim, but it still happens. Usually it's when they're not wearing the mouth guard. And if a tooth gets knocked out, if it's a baby tooth, most often parents just see it and they look, is it a baby tooth, permanent tooth? Baby tooth, it's just best to let it heal. Get in to see the dentist just to make sure there's no other damage. If it's a permanent tooth, the best thing is to, if it's been moved, still in the mouth, but just been knocked out of position, leave it until you can get in to see the dentist. Oftentimes we can reposition that tooth there in the office and take care of it.
Will it turn brown, though?
It can. Oftentimes, too traumatic of an injury will cause a tooth to darken in color, and that's something that we can always handle. So.
Yeah. My son slipped in the bathtub, actually, and now he has a little bit of a brown tooth, but luckily that'll go away when he loses it.
If it's a baby tooth, yes. Good news, baby tooth, it will go away when they lose it. Permanent tooth, that's a traumatic injury, and that tooth will need to be treated, so it won't be that way. And we can take care of that, though.
Now, I heard you have a little trick, though, if a tooth falls out.
If you do have a tooth get knocked out, a permanent tooth, like I said, baby teeth we wouldn't do this with. A permanent tooth, you can actually, I've had it happen. It was on a soccer field. A high school girl went up for a head ball and got her tooth knocked out. The entire team's searching around on the ground for it, and they picked it up. The mom had already called me on my cell phone, and I told her, just drop it in some milk. She swung by, I think, 7-Eleven on the way into the office, put it in some milk. We brought it in. We were actually able to put the tooth back in. We did a root canal while it was in my hand, so we didn't have to even number up. And we put the tooth right back in, and she still, to this day, several years later, has the tooth in there. So.
What do you think it is about milk that's going to save it?
What you want to do is put it in something, and best thing is don't scrub it. Don't try to clean it off. Let the dentist clean it off. The milk is just, most of our teeth, their calcium is the mineral that's in it. So you're just putting in something with a little calcium. They actually sell a solution that you could get called Hank's Balanced Salt Solution. Just pick up a cup of milk from anywhere if you have it and drop it in there and bring it into your dentist. So.
Now, we've been talking about, some children's, injuries, emergencies. What about adults? Do adults ever have any kind of, emergencies with their teeth?
We can have the same thing with adults. Again, broken teeth, moved teeth from having accidents. But most emergencies with adults are things where you have a tooth that gets what we call abscessed or something. Maybe they broke a tooth and it breaks into what we call the nerve of the tooth. And those are a little bit more traumatic, and we usually handle those a little different. So,
like with a root canal, probably?
More often we see that. It's a patient may need a root canal. Everybody's heard the stories of root canals and have this horrible pain. It's not the root canal that's the bad thing. It's the pain that you have before the root canal. The root canal is actually going to take care of that pain. So yes, root canals are one of the things that we see most often with adult emergencies.
Okay. Yeah. Well, one last question. What are dental implants?
Oftentimes when a tooth gets knocked out, if it's an adult tooth, and we can't put it back in, one thing that we can do now is we can actually replace a tooth with a dental implant. It is essentially a titanium tooth that we put a pretty looking crown on top of that to make it look like a natural tooth again. In
case you do have one busted out that you can't replace.
In case you can't get it off, or a root canal can't save it, then we can always take it out and do an implant in that place.
So you're always ready to have pretty teeth no matter what.
We can take care of it. That's for sure. Yes.
Great. Thank you so much, Dr. Fletcher, for coming in, sharing us some good tips on if we pop a tooth, maybe.
Remember, prevention's the key.
That's right.
All right.
Thanks so much. If you want to see this again, definitely hit up our website at ciliving.tv.